A lot of factors play a role in staying healthy. In turn, good health can decrease your risk of developing certain conditions. These include heart disease, stroke, some cancers, and injuries. Learn what you can do to maintain your and your family's health. What you eat is closely linked to your health. Balanced nutrition has many benefits. By making healthier food choices, you can prevent or treat some conditions. Did you ever try fish oil? Fish oil is extracted from the flesh of fish. It is primarily composed of two fatty acids known as docosahexaenoic acid, DHA, and icosapentaenoic acid, EPA, and also contains smaller portions of alpha-linolenic acid, ALA. EPA and DHA acids are considered normal constituents of some human tissues, including brain cells, retina, adrenals, and sex organs, all the most active tissues in the body. These acids were given their name when researchers found that they were essential to normal growth in young children, thus they are defined as essential fatty acids. These acids cannot be absorbed through the body, so it is up to our diet to determine the amount of omega-3 fatty acids in which we consume. EPA and DHA are precursors to eicosanoids and provide an anti-inflammatory effect throughout the body. These fatty acids are used in the formation and fluidity of cell membranes, which help with maintenance of blood pressure and heart rate, nervous system function, and in hemostatic regulation, consisting of blood clotting and thromboxane production. EPA is a long-chain fatty acid. It is the single vital nutrient that controls communication between nerve cells and the brain. DHA is another long-chain fatty acid. It is known as the building block of the brain cells since it is the most important component that makes up the brain. EPA and DHA fatty acids are more commonly found in cold water fish such as salmon and tuna. This is one of the main reasons why people agree that these fish are good for our overall health. Omega-3 fatty acids can be purchased at any retail store and do not require a prescription or a medical practitioner referral. It is not expensive, usually ranging from $7 to $12 and usually come in capsules that contain 1,000 milligrams. It can be taken up to 3 times daily and is usually more effective after a meal. The gel or capsule is usually enteric-coated, which protects the substances inside the capsule until it reaches the small intestine where it is readily absorbed. Although excess amounts of fish oil are harmful to the body, fish oil supplements do not contain any form of mercury, according to the manufacturers of the drug. There is currently one omega-3 medication that does require a prescription. This medication is generally used for those who have high triglyceride levels, and its action is to significantly lower these unwanted levels. The daily recommended dose is 4 g per day. It can be taken as a single dose of 4 capsules or can be taken at 2 separate occasions that include 2 g per dose. It is recommended that this product be taken with meals. Some of the problems that can occur with low intake of omega-3 fatty acids include dry, itchy skin, as well as coarse, bumpy patches on the skin, soft broken nails, dry, dull hair, and allergies. Other problems can cause poor brain function and brain development in children. Heart problems, cholesterol, arthritis, and diabetes are some of the major conditions in which fish oil provides some form of benefit or improved health. Fish oil supplements seem to have an antiarrhythmic effect on the heart as well as prevent cardiac arrest. In doing this, fish oil can help lower the mortality rate of those individuals having heart complications. Fish oil can benefit the heart because the EPA and DHA that make up the supplement helps to prevent plaque deposits and blood clots inside arteries. Fish oil improves the ability of muscle cells to take up glucose in the presence of insulin. This proves to be beneficial to those with type 2 diabetes. Fish oil helps with cholesterol by lowering levels of LDL while also increasing levels of HDL. This may limit the amount of prescription antihyperlipidemic drugs that a person might have to take in their lifetime. Fish oil has been shown to influence cholesterol by altering the production and catabolism rates of HDL lipoproteins. The high rates of HDL can lead to a decrease in atherosclerosis by eliminating excess cholesterol from arterial cells. Fish oil has been shown to have anti-inflammatory effects, especially the icosapentaenoic acids, EPA. They can improve overall function in joints as well as limit the amount of other anti-inflammatory drugs that a patient must consume with conditions such as arthritis or other inflammatory disorders such as inflammatory bowel disease. Fish oil has been shown to have effects in dealing with certain psychological disorders. It has been found that omega-3 fatty acids are known to have membrane-enhancing capabilities in brain cells. They cause more production of two neurotransmitters, serotonin and dopamine. This allows patients to focus better on tasks that are at hand without as many distractions. The effects of serotonin have been shown to help individuals better deal with stress and other activities. Fish oil has also been shown to have a number of beneficial benefits on the brain. It has been shown that 60% of the brain is made up of a structural fat, which has a high number of DHA in it, and the brain requires a regular intake of good fats such as the ones from omega-3 fatty acids. Low intake of omega-3 fatty acids can lead to conditions such as ADHD, dyslexia, depression, aggression, Alzheimer's disease, or other dementia. The fatty acids that make up fish oil have proven to be effective in autistic patients, with those individuals taking the supplement improving in language and learning skills in at least 8 different testing areas. Possible benefits to autistic patients showed decreases in hyperactivity in their behavior. There have also been a number of small trials where fish oil has been proven to be effective in treating children with ADHD. In these studies, it was documented that students had an increase in school performance as well as a decline in restlessness. This can benefit a child because fish oil has minimal side effects compared to the neurostimulatory drugs that are usually prescribed for ADHD. There have also been studies that indicate that fish oil relates to the risk of cancer. It has been shown to help prevent 3 of the most common cancers, which are breast, prostate, and colon. Omega-3 fish oil may stop the alteration of a normal cell to a cancerous mass. They may inhibit unwanted cellular growth, and cause apoptosis of cancer cells. Possible contraindications include those who are allergic to fish or have developed a hypersensitivity to fish products. Any person that has a bleeding problem or who is currently taking warfarin or another anticoagulant therapy should probably not take this supplement. Fish oil has been shown to lower blood pressure. Those individuals who usually have low blood pressure should not take this supplement because it may lead to severe hypotension. Obesity is defined as having a body mass index, BMI, greater than 30. Globally, about 39% of adults are overweight, while 13% are obese. The numbers are even higher in high-income countries like the US. Obesity can significantly increase your risk of other diseases, including heart disease, type 2 diabetes, and cancer. Fish oil supplements may improve body composition and risk factors for heart disease in obese people. Furthermore, some studies indicate that fish oil supplements, in combination with diet or exercise, can help you lose weight. However, not all studies found the same effect. One analysis of 21 studies notes that fish oil supplements didn't significantly reduce weight in obese individuals but did reduce waist circumference and waist-to-hip ratio. Like your brain, your eyes rely on omega-3 fats. Evidence shows that people who don't get enough omega-3s have a greater risk of eye diseases. Furthermore, eye health begins to decline in old age, which can lead to age-related macular degeneration, AMD. Eating fish is linked to a reduced risk of AMD, but the results on fish oil supplements are less convincing. One study found that consuming a high dose of fish oil for 19 weeks improved vision in all AMD patients. However, this was a very small study. Some patients may also complain of skin rashes. In this event, the patient should stop taking the supplement. Many patients will complain of a fishy aftertaste with the supplement and should be encouraged to take it with meals. There will be many patients who encounter their medical professionals to decide if this supplement is right for them. Fish oil will be one of the main supplements that will be debated in a number of medical studies. Providers should educate their patients about the overall benefits that can come from this alternative supplement as well as assess their risk. Many people do not realize that the fatty acids that are found in fish oil are essential to our overall health. As healthcare providers, it is up to us to inform our patients about the valuable source of energy and nutrients that this supplement can offer. Side effects from omega-3 fish oil may include a fishy taste in your mouth, fishy breath, stomach upset, loose stools, nausea. Taking more than 3 grams of fish oil daily may increase the risk of bleeding. If you want to take higher doses of omega-3 fish oil supplements, talk to your doctor first. Your doctor can guide you in supplementing your diet with omega-3 fish oil. Also, your doctor can monitor all aspects of your health if you take higher doses of fish oil. For people with very high triglyceride levels, prescription omega-3 preparations are also available.